Now that you've found UBN Radio and discovered our quality talk shows, it's time to spread the word to friends, family, and the universe. 24 hours of music and talk. Radio without limits. That's why people keep coming back for more. That's ubnradio.com.
And greetings and salutations, everyone. Oh, there we go. You ready? Okay, greetings and salutations, everyone. You've tuned into Dr. Judy WTF here at UBN Radio Network. I'm your host, Walt Lusk, and let's see if we can see us. Oh, there we go. And you can see us on Facebook and, of course, on ubnradio.com, Channel 2, and listen to us on iHeartRadio and also iTunes and others. Today, our show we're Dr. Judy WTF, What the Freud, and, of course, Dr. Popularity. Dr. Judy Rosenberg is here in studio with a plethora of patients and stories and testimonials. We had a really tough show last week. We talked about sexual abuse, and we thought we'd do a little bit different this week. We're going to talk about therapy.
Actually, rape.
Well, yeah, rape and sexual abuse.
Yeah.
And this week, the question is, are you a candidate for therapy, and how do you know when it's time to seek therapy? And we're going to also address some misunderstandings and some misconceptions as well. And this is a call-in show, so if you want to be on the couch with Dr. Judy with your emotional ouch, feel free to call. The number is area code 323-843-2826, and be happy to interface with Dr. Judy right here on the radio.
And we love call-ins, so
We
please
certainly
pick up
do.
the phone, and if you don't want to use your real name, aliases are welcome.
Absolutely.
Yes.
And so keep those calls coming. And or you can write us at info@drjudywtf.com for a song we're going to shrink later, a fun one by Green Bay.
Green Day.
Oh, was it Green Day? Okay.
Yeah, not the Bay.
Maybe I'm thinking of football.
I think you are.
Green Day.
Not the Packers.
Yeah, so football season's over. Okay. So, basically what I wanted to start with is, I know Dr. Judy's got a lot to say, is, understanding therapy and how it works was a good article. And basically, according to the National Institute of Mental Health, more than a quarter of Americans, that's 25% of you, and us, adults experience depression, anxiety, or any other mental disorder in any given year. Others need help coping with serious illness, losing weight, stopping smoking. Still others cope with relationship troubles, job loss, the death of a loved one, stress, substance abuse, or other issues. So that's really what this is all about. But, the point is, a lot of people don't go because, they're just afraid. And the statistics, this number was really interesting, Dr. Judy. 88% of people that actually go on one session feel much better after the one session. So that's a huge number, and feel incredibly better in 7 to 10 visits.
Which is a testament to the phenomenon of expression versus repression.
Yes.
So I think that it's worthy to take note of the fact that most of the therapeutic progress happens within 7 to 10 sessions, and that it just so happens that the mind map therapy takes place in 10 sessions.
10 sessions.
And
yes.
10 sessions, and then follow up as need be. Although I think that anybody really could be a candidate for therapy, but I could tell you who usually doesn't show up for therapy.
The ones that need the most?
Maybe the ones that need the most. Okay, so who doesn't show up for therapy are the people who are pushed into it. They may show up once, but then they've got this disgruntled look on their face, and I have to deal with it, and ask them, are you really wanting to be here?
Well, yeah,
nah, my mother told me to
come.
Very
poor motivation.
Very poor motivation, and I tell them that therapy's not a hostage situation, so they don't have to be here. And sometimes they come back because life presses a little bit harder on them, and sometimes they just are very resistant. They're really not ready for the therapy. Now, because a lot of people have been tainted with bad therapy. Some people don't come back for therapy or don't really want to give it another opportunity because they've had bad experiences. Like one of my major complaints for the people who do come in is, Dr. Judy, I've been to therapy before, and the lady or the doctor or whoever was very, very nice. We talked for a few years, as a matter of fact, and I felt better every time I left the session, but then I never really got anywhere with him or her, and just went around in circles. And I call that the "how does that make you feel" type of therapy, which if you've been listening to previous shows, you know that I'm not particularly a fan of that.
Well, it's interesting you should say that, because
So that ruins it.
one of the questions that people are afraid that a therapist is going to ask is, how do you feel?
Oh,
Right?
really?
Yeah, we'll get to that one. But
Okay.
Was one article here that said basically there are good therapists and there are bad therapists. Okay. Let me just start with the bad one. A bad therapist talks about themselves too much, gives too much advice, and doesn't acknowledge their own bias.
That's really, really important.
Absolutely.
It's not about you. If you're a therapist, the session is not about you. You're getting paid so that it's not about you, and the floor belongs to the person. Now, oftentimes I'll bring up examples of my own life, and therefore I use my own mistakes. I use some of my own experiences to make a point or to help them to not do what I did. I like to give away presents. Don't do what I did. And that's a really interesting way to talk about yourself, because in that case, the therapist, or myself in this case, is talking about myself in order to drive home a point and really give a good example that hopefully will be a wisdom-based piece of information or lesson for them to take into themselves. So yeah, that is a really, really big no-no. Do not talk about yourself. You will scare your patients away. What was the other one, Walt? Or a couple of other ones? I forgot. You said some other do nots, right?
Funny you should ask. Okay. Let's see. Bad therapist. Where did it go?
Bad therapist.
I lost the page. Hold
It's
on.
okay.
Oh, nope. I'll find it. But
Okay.
anyway, talking about themselves.
Yeah, talking about
And
themselves.
they offer advice.
Oh, offer advice.
Yes.
Therapies, I think that a patient who pays good money for therapy, rightfully so, expects their therapist to be insightful and analytic. And without that quality, a therapist really is not going to be giving the best of their best. So if the psychologist doesn't have an analytic mind and can't see insight into the patient, then that is not a therapist that you necessarily want to stick with. Advice is cheap. You can get advice from friends, and advice doesn't necessarily belong in the therapy room. In many instances, sometimes it does, and you have to use it really, really judiciously. But therapy is not about advice giving. Therapy is about shining the light on the truth and shining the light on old patterns that are stuck, so that people can see and come in touch with their own truth, and out of that make better choices for themselves. So rather than give your patients advice, I think the better way is to clear the pathway so that they are clear-sighted, so that they can make better life choices.
I couldn't agree more. What's interesting is, one comparison that they gave really quickly was, going to a therapist versus a medical doctor for a medical condition, right? There's a little stigma going to a doctor when you feel sick. But what about seeing a therapist to talk about problems or gain an ally or grapple with a mental illness?
Yeah, it's a little harder.
Yeah, it's a little different. People who go to therapy are finding a treatment for their mind and their emotions, the same way doctor treats your body. Yet they deal with the unfair misconceptions and assumptions about why they're going and what it must be like.
And another misconception is that you'd be surprised to know, Walt, that a lot of people don't know the difference between a psychiatrist
And a psychologist.
Yes. And an MFCC, and
Marriage
an
and family
LCSW.
married and family child counselor and licensed clinical social worker.
Right, and it took me a while to figure all of that out. Also, so just to be clear, a psychiatrist has been to medical school.
They're an MD.
They're an MD. They have studied psychotropic medication and how to apply psychotropic medication properly. So if you need a medicating psychiatrist, it's the psychiatrist that you want to go to.
Yeah, they write their prescription.
Right. If you want to explore your issues on a psychological level and leave the drugs out of it, or even if you want to explore your psychological issues while you're seeking psychiatric help in conjunction with the psychiatric help, you then seek the services of a psychologist. Psychologists are licensed by the Board of Psychology. MFCCs are licensed by the Board of Behavioral Sciences. So psychologist is about the top level of education that one can receive in the psychological realm of the profession.
And there are two types of psychologists. There's a PhD, and here in California, there's a PsyD, PSYD. And they're both doctors and are therapists.
Right. And so psychologists, because they're licensed by the Board of Psychology, they have to pass more stringent examination and do more hours of pre-doctoral work, post-doctoral work, and so on. And so let's get back to who is a candidate and who is not a candidate for therapy. And one of the groups of people that is poor candidate for therapy, and we talk about this quite a bit on our shows, people who suffer from extreme narcissistic personality disorder. They know better, and they may come to therapy only because their spouse or their coworker or somebody is really, really fed up with them, or they may come to therapy when they are out of narcissistic supplies.
Out of narcissistic supplies.
They're poor and they're growing older.
Does a narcissist ever run narcissistic supplies?
They need plenty of it, and they don't want to be confronted. They don't want to be confronted with their very fragile defense mechanism.
Absolutely.
Because they hold a false self. Because
Absolutely.
Narcissism is an injury.
Yes.
It's not a something that people are proudly wearing as a badge, feeling that they're better than. As a matter of fact, they don't feel that they're
No,
better
they're not.
than.
They're most insecure practically of anyone. I love this. This is an article about will a narcissist seek therapy. I think you sent me this one. Narcissists consistently criticize the therapist and challenge them in the same way they test everybody else.
And I have a story there for you.
Okay. One more line.
Go on.
They try to control the therapy and do what they want instead of what the therapist thinks they need to do.
Right. So there's no therapeutic leverage.
None.
And I have told this story before, but I think it's worth telling. When I was an intern, I was assigned to a case, and it was quite a case. She was actually a very, very talented songwriter from back in the old Hollywood days.
Back in the day.
Wonderful woman. You know, we got past a lot of the narcissism. And initially, she really tested me. And you've got to understand that I was a young student with very little experience. And her first comment was, you know, that this room your couch is ugly and the furniture is ugly. And it was all about demean, devalue, destroy, the 3 Ds. And of course, I started questioning my competency as a therapist because I was so new at it. And the room, of course, was pretty ugly. She was right, because it was one of these old, stinky intern rooms.
Probably didn't even have a window.
Probably didn't.
Yeah.
Didn't have a window.
No window.
Right. So the question in my mind, of course, is that why is this wealthy, very, very well put together woman seeking therapy from an intern? I have no idea why she was doing that.
Sliding scale.
Oh yeah, I was big time. I slid. I was the bottom of the barrel of the slide. so she kept doing this, and then I realized that she does this with everybody. So I turned to her and I said, "Why are you here?" And she said, "Well, she's not talking to her son. She barely talks to her daughter. People don't like her. She's feeling really lonely. She's in her 80s now. She's getting old." And so I said to her, "So do you do this to everybody?" And she just stopped, and she looked at me, and I think she gained a new level of respect. For $9.99. I don't remember what I was charging her at the time, but she really gained a new level of respect for me. And from that moment on, she started idealizing me, and she would bring in her tape recorder and tape the sessions, and she just thought that I was really, really the best. But here's the deal. Every time I set boundaries, she'd pop out of therapy.
She'd just test them and test them and test them.
She would just
Yep.
fire me, and
Yep.
then a few months later, she'd call me again and rehire me, and this went on and on. So my point is this: people with a very, very delicate sense of self don't necessarily want to be confronted, but when they're older and when they're lonely and they have really nobody that cares about them, they start thinking, yeah, maybe I need to clean up my act a little bit. And
Seek a little
how
assistance.
I treat people. Right.
So this is a call-in show, folks. If you want to call us, the number is area code 323-843-2826. And we'll put you on the couch with Dr. Judy with your emotional ouch. Or you can write us at info@drjudywtf, and we'll answer and respond accordingly. Mm-hmm. I've got some signs about when you should seek a therapist. The psychological help is for those who want a clear condition to manage and can be just as important. Aside from suffering needlessly, those who are in distress may actually make the problem worse by avoiding professional help.
Right, and this is a very good point because, again, people don't want to be confronted in their defense mechanisms, because if they're not feeling well and they're smoking, drinking, drug, sex,
abusing,
rock and roll, they don't want the therapist necessarily to bust them, which brings me to another category of people who may not necessarily be the best candidates for therapy, people who are seriously abusing substances. I do take them on because I think that it's a good starting point for them to talk about their defense mechanisms. However, if they don't get themselves into some sort of a support group, mainly an AA or an NA or some kind of a support group, therapy can get really costly because then they need so much support.
Yeah.
And they need a community to really be the holding environment.
It takes a village.
It does in that case.
And the earlier someone gets help, the easier it is to get through the problem.
Right.
So a couple of things. First, everything you feel is intense. We all get angry and sad, but how intense and how often? Feeling overcome with anger or sadness on a regular basis could initiate an underlying issue. The intense form of anxiety could be very debilitating, as for example. So it could lead to panic attacks, and even cause you to avoid things. So if you're going down that road, you might want to see a therapist.
So just to give you an idea of how I see anxiety and panic and so on, I had a woman, one of my really special people that I work with, because she has grasped the mind map so thoroughly, and she's really morphing so quickly in front of my eyes. And she came in because she was suffering from panic attack, and it turned out that she had a pretty abusive background. Her parents were always fighting and arguing, and it was hitting her. It was a pretty bad environment, and what she had to do, because she couldn't express her feelings, because childhood is a
hostage situation.
Right, she couldn't talk. She had to bury her feelings, and so I see the truth is up here, and then if you can't tell the truth, you have to repress it, and therefore it gets pushed down into the anxiety territory, and then if you still can't express it, and the feelings build, it'll either break through into a panic attack, so it'll go sideways, or the person will suppress it even further, and that's the depression.
When's the explosion come?
Well, the explosion is more of an implosion in this case. Okay, the explosion can come in the form of anger and then projection. So when the emotional bandwidth gets so stretched that there's no more capacity, then they're going to start pushing it downward. They're going to swallow their feelings, so to speak, and repress their feelings to the point of depression, or they're going to project their feelings onto other people, and that'll be the anger, and that'll
as
be
you said, depression is anger inward.
Exactly. So, so the outward is the hostility, and neither one of those really work, because neither one of those are healthy forms of expression, which is what therapy is all about.
Absolutely. Next is you suffered a trauma and you can't seem to stop thinking about it. The pain of death of a family, a breakup of a job, which both centers around grief. Can be enough to require a bit of counseling. And so if you find you aren't engaging in life and you're pulling away and withdrawing, you might want to speak to somebody.
Yeah, in that case, you're really a necessary candidate for therapy, because if you've been traumatized and you allow that post-traumatic stress disorder to go untreated, then that disorder can linger for years, if not a lifetime. So I think that people think that they can get away with repressing all of these feelings. Just this week, I've had several people say to me, you know, I'm here because it's time. I'm here because there's been so much buildup and just so much emotion that I've really never dealt with. And the subjects are, I've never dealt with the death of my mother. I've never dealt with...
And she's been gone for like years.
Yeah, I've never dealt with the child abuse that I never really talked about. Or I've never really dealt with chronic depression that's been eating me alive. And so... I don't know why, but this particular week, a lot of people are almost singing the same mantra of, it's time. It's been so long since I've dealt with these feelings, or maybe I've never dealt with these feelings. And then what happens is that these feelings start eating away at the fiber of the person's being. And then their whole life turns into a bunch of chaos, defense mechanisms, and breakdowns. And if you don't mind, put the mind map up so I can visually show you what's going on
and
here.
Those of you who are listening, you can go to drjudywtf.com, or you can go to the iPhone and download the Psychological Healing Center app.
Yes, and you can read a piece of my book, Be the Cause, on the app, and you can
Healing Human Disconnect.
See the blogs on the app. There's all kinds of stuff you could see there. So anyway, thank you. Put that mind map up there. And the top third of the mind map represents your past and how you encode the wounds of childhood into the fiber of your being. So the first panel, all the way to the left, represents your darkness and your light. The wounds of childhood would be the darkness. Wounds such as physical abuse, sexual abuse, verbal abuse, smothering, neglect. These would be the primary ones. And so out of these wounds are created reactions to the wounds. This is where the fight-flight stuff comes in. This is where the amygdala, the primitive brain, starts processing the emotions on an emotional level. And then out of that comes an encoding, which is more of a cognitive encoding, such as I'm not good enough, I'm not lovable, I'm stupid, I'm not this, I'm not that. And so what happens is that as these wounds get built up and over time encoded, they then get triggered by the environment. And so the people that come into therapy usually come in panel 4, 5, 6, which is the WTF part of it, or the what the Freud, or the chaos, defenses, and the breakdown part of their life. Because as Sigmund Freud mentioned, and this is part of his contribution to the field of psychotherapy, is that if you don't finish the psychological business, if you leave the unconscious in an unconscious place, you repeat patterns. So what's repeated is 4, 5, 6, chaos, defenses, and breakdowns. And people come to therapy when they're in chaos, defenses, and breakdowns. People rarely come to therapy in the last chapter of this mind map, which is the paradigm shift and the healing and the unity. They don't come in at that point because not that many people are going to call me and say, hey, Dr. Judy, my life is going really, really great. I want to keep it that way. So can I come in, make an appointment, and just secure my wonderful life? I don't get too, occasionally I'll get a call like that.
Yeah, but
not
most
very
of the time
often.
they were former patients.
Yeah.
Yeah.
Yeah. And sometimes former patients will come back because they have a life crisis, and they want to discuss the pressures that are eating at them at that particular time. But again, usually the candidates for psychotherapy are the people who are in some sort of crisis, because it's the crisis and the pain that actually catalyze the person. And I think there's an article on that.
Along those lines of pain, the third one is you have an unexplained and recurrent headache, stomach ache, or rundown immune system. If we're emotionally upset, it can affect our bodies. Stress can manifest itself in really, really different ways. Like, for example, it's a stomach headache or muscle twinges that just come from nowhere. So your body is just physically reacting in a physiological manner. Which could obviously imply there's some underlying challenges that need to be addressed mentally.
Absolutely.
Yeah.
So the mind and the body are interconnected.
Yes,
so
sir.
who's a candidate for therapy? If you've got a headache, chronic stomach, and you've ruled out organicity, then you're a candidate for psychological help. I have a patient who has tremendous somatic manifestations, and the symptoms move around a lot. First, they're in his shoulders, jaws, knees, all over the place, and they just keep moving. And through the analysis and through mind mapping, the whole process, we have arrived at some pretty powerful aha experiences as to what exactly the end goal of that is. And maybe I'll have him share that on one
Maybe
episode.
one of the days
That
he'll
would
call
be
in.
really great.
That'd be great.
But you see, people are there because they're in some form of crisis, not because they're having a nice day.
And next is you're using substance to cope. We've already talked about that, but if you're a substance abuse using different substances more than you normally do, that means you're trying to overcompensate and self medicate because of this issue and challenge. Next is you're getting bad feedback at work. We spend a lot of time at work, and sometimes we have a work family. And if your work performance has been impacted, maybe there's an emotional, psychological challenge, a disconnection from your job, if you will. It's time to talk to a professional, okay? Or if someone at work goes, hey, are you really doing okay? Lately you just kind of look down or depressed, or, you're just not focused. Take note of that, because they're looking at you from a different perspective, and you may not even realize that it's starting or it's there. And gosh, you know what? Maybe you might want to invest in yourself, which is what therapy is. It's the best investment you can ever make in yourself.
And sometimes people who are in dysfunctional corporate settings are the scapegoats, or they're the identified patient of that system. And so we did 3 episodes on healing corporate disconnect.
We did last year.
So sometimes the corporation itself is the candidate for therapy, and the analysis is really about seeing what rules and roles are being played out here, and how the whole dynamics is affecting the emotional well-being of the people involved on the corporate level.
And along those lines, next is you feel disconnected from previously beloved activities. Maybe those clubs or friends or meetups or family gatherings that just have lost their previous joyfulness, and it's just something a sign is amiss, and you've disillusioned feelings and just not really on point and unfocused again. So you might want to go into a little therapy to get a checkup from the neck up, and start in a new or a better direction.
Right. And so wherever we're disconnected from, we're going to feel pain. If it's a loss of a loved one, a loss of a job, a loss of status, it doesn't matter. There's a disconnect there. And so if you've previously encountered some sort of a loss, you're probably a candidate for therapy, because it's really, really, unless you have a super great support system, it's really difficult sometimes to process it all yourself.
And lastly, your relationships are strained. You're having trouble communicating about how you really feel, or being able to identify in the moment, or unhappy during interactions with a loved one. You know what? You just might need a little empowerment and a little way to make better choices and decisions. And again, that's where therapy comes in.
Right.
Want to talk about some misconceptions here at Dr. Judy WTF. Tuning in. Thanks for listening and watching at ubnradionetwork.com. So wanted to talk a little bit about that. First is only crazy people go to therapy.
Sure.
Right? I
Right.
mean, we all know that's true.
Although some people in some cultures really believe that more than
Yes.
in other cultures.
Yes.
Why am I coming to therapy? In my country, only schizophrenics and people who really break down go to therapy. So yeah, it's also culturally determined. Yeah.
How about therapy's only for people with mental illness, right? I mean, therapists can only bill insurance companies once they diagnose someone or have a pre-existing diagnosis. So, good therapists are very, very careful with labels. And you don't need to have a mental illness, obviously, as we discussed here, to see a therapist. Even if it's just a few sessions, you might be amazed at how you would look at things in an entirely different perspective. And in Dr. Judy's book, Be the Cause, Healing Human Disconnect, which is available on Amazon, at the end of every chapter, which is really fun, is how to think like a shrink. So Dr. Judy's perspective is to make sure you can do this and kind of get a refreshing take a step back and get a refreshing perspective right then, right there.
Right.
Yeah.
Right. And another category of people who may not necessarily be the best candidates are people who don't have any ability. Well, that's a big word here. It's extreme to have any to really process or on any level get interested in self-reflection or becoming insightful. If they lack that desire, that quality, it's really, really hard to bring them from the unconscious to the conscious. And what I often encounter there is that people will just run all over me. They'll just keep talking and talking, and they'll yabba and
Well, they're
yabba
probably
and
nervous
yabba.
like crazy and just can't shut up.
Yeah, but they just, it's really, really difficult. And I think the mind map helps a lot. It's just like, no, we're focusing on your wounds of childhood. We're focusing on why your marriage is falling apart. We're focusing on the blueprinting of your past. So we're going to see how things. Yeah, but my wife. Yeah, but you don't understand. My wife, she's so lazy, and yeah, but she doesn't shave her legs. So it's really, really difficult. And then at some point you really realize that person's not really there to understand what's going on. They're just there because they want to complain and they want somebody to say, "You're right. Your wife sucks."
To co-sign their BS.
Co-sign their BS.
Yeah, they're
and
Bravo
that's
Sierra.
not what therapy is about.
Or people go to therapy are broken or something is wrong with them, right? After benefiting from therapy, your attitude changes. I mean, there's nothing wrong with me. It's just being self-aware. Therapy is only a tool to help people explore themselves. It's not a fix.
Right. And as I say in my book and to my patients and here to all of you, we're not sick. We're made sick. We
Right.
are not the cause of part one of our lives. We're not the cause of having parents who are abusive or neglectful or smothering or any of that. However, we become at the effect of poor parenting. However, we can be the cause of better outcomes for part two of our lives, which
If
is
we
why
invest in
the
ourselves.
therapy is important.
If we invest in ourselves.
Yeah.
We've touched on this one real quick. You need a lot of money to go to therapy, and you don't. You can do it online with Dr. Judy or one of her
Sliding
on a
scale
sliding scale.
therapists available.
They're all
Yeah,
available. So there's
very
options, a
much
lot of
so.
options there.
Right.
People go to therapy who are too weak to handle things on their own. Imagine telling someone who was recently in a car accident that seeking a doctor meant they were too weak to recover from their injuries on their own. I mean, if you got a broken leg, it's, it's going to need a little help. So it sounds harsh, but it's not far from telling someone they are feeble because they've used therapy to deal with trauma, mental illness, stress, or just toughing it out. Okay, it's not for the weak. I mean, therapy is really, really hard work.
It takes somebody to have a certain sense of humility and a real desire to to be curious.
Yep,
You know, you
be
have
curious.
to have a general
Yep, and
curiosity.
strong.
What is going on with me? Why am I feeling depressed? Why am I overeating? Why am I cutting myself? Why am I drinking? There's got to be some sort of a question of what's going on here, and the humility to reach out to another human being and then expose all of their wounds and trust another human being. So another, speaking of trust, another category of people who sometimes don't show up for therapy, of course, are the paranoid and the avoidant, right? These people don't show up for obvious reasons. They're paranoid. They like to avoid.
They don't show up for a lot of things.
Yeah, they don't show up for a lot of things. Correct. So but sometimes they, actually, I have really enjoyed my work with paranoid people, because the mind map just happens to be really effective for that population, because the mind map really elucidates how they built that paranoid wall around them, and so that they get to see that this wall was in protection of their first few years of life, and that as they start to develop a trust in the therapist and trust in the therapeutic process, that they could see that their wall was built around lies and misperceptions, and around what I call the cracked lens of perception, which distorts the truth. So they're really interesting and fun to work with, and I've had some real strong breakthroughs with people who have been shelled up that way.
Everyone who's in therapy starts going after some tragedy or crisis occurs, right? I mean, dealing with life's general melees, or refuting a long-held negative belief. Nothing's horrible has happened to these people who want a happier life. You can prevent a future crisis like a divorce, right, or something like that. I mean, hospitals don't just have emergency rooms,
Right.
you know, and therapists don't have a mental and emergency fallout shelter either.
Yeah.
Okay? Clients are lazy. They let the therapist do all the work, which is really far from the truth. It's a far cry from seeing a doctor. Most successful ones in therapy can think for themselves. Therapy is about working with the therapist as a team and helping you come up with a different perspective. Again, we've just talked about not making the therapist think for you. That's not therapy.
I'm really a fan of helping people think like a shrink,
Yeah.
because I owe my patients the ability to think on their own, process their own feelings, so that they don't have to depend on me for years and years out. So I think that people who are a candidate for therapy are people who are truly seeking solutions. They're not not just wanting to babble away and talk about the daily woes, but that they're truly wanting to get to the bottom of it and morph out of the pain and suffering.
Yep, definitely get away from pain. People who see a therapist don't have friends, family members, or any significant other who are willing to listen.
These are myths, right?
Oh, these are all misconceptions.
Okay.
Yeah.
Right.
The problem is maybe you've complained too much to your friends or your family, and they're tired of listening to all of your venting and whatnot.
That happens.
And you need more of a neutral third party
Right.
to chat with that can give you, again, a different perspective.
Right. Just today, I had a young lady who came in, and she was her mother's therapist. So her mother roped her into being her confidant, and she kept saying, "Mom, I don't really need to hear this. This is
TMI.
common.
Too
This is
much information."
I hear this a lot.
Yeah.
Parents who become the patients of their own children. It's a little ass backwards.
Who's the parent?
Who's the parent here, right? And then they're burdened terribly. So these are people who really do need to seek professional help, but just so happen to seek it from their own children. So they think they're not candidates because they have that listening ear, but as the child or the adult child gets healthier, they're going to pull out of that codependency pretty quickly, and then the mother may be a candidate for therapy.
You think?
She'll lose her therapist.
You think?
You think.
People who go to therapy are on medication, and we've already talked about that. If you're going to a psychiatrist or a therapist, there is no medication unless you're going to a psychiatrist, which is the ones that have the MD after their name.
And sometimes they work hand
in conjunction.
hand. Yes, sometimes they
Work
do.
together. Yeah. And then if you go to therapy, you are probably a woman. Unfortunately, this one is more true. I don't know in your practice, Dr. Judy, but it seems that from what I've read, more women go to therapy than men.
I have quite a few males in my practice, but I think that's generally I think it's generally true. I think that if I did take a statistics on that, I think probably you're right.
Yeah, well, women are always better to go to the doctor in the first place, right? Us guys never go to the doctor. I'm fine. I feel fine. I've got this pain in my side that I've had for 6 months, but I'm fine. Therapy is more than treatment. It's a lifestyle choice. Some people go to church. One patient said, "I go to therapy." Right?
Right.
It's a very religious experience.
Very religious
There you go.
experience. Yes.
What else in the last few minutes? Signs that you could benefit from therapy, real quick. You feel overwhelmed, a prolonged sense of helplessness and sadness. Your problems just don't seem to be getting any better, despite the efforts from your family and friends. You find it difficult to concentrate at work or at school and carry out everyday activities. You worry excessively, expect the worst, or constantly on edge. That's more of an anxious situation. And lastly, your actions such as drinking too much alcohol, drugs, or being aggressive or harming others. So you're might be harming yourself and potentially others. Your candidate for
Right,
therapy.
and other people around you are complaining about your behavior, and so again, if your loved one is dragging you to therapy, you might not stay in therapy until life gets even worse for you. I think that at the end of the road, people who don't get some kind of an intervention keep breaking down, and then when they bottom out, then they're a candidate for therapy.
Yeah.
Suddenly, they're a candidate when they lose their spouse or they get a DUI or something really
crisis.
horrible happens to them. Right.
And lastly, I want to close with this one is it doesn't have to last for the rest of your life. Or, there has to be, as we talked earlier, Dr. Judy, before the show, there needs to be an exit strategy, which again is one of the reasons why the mind map works so well is because there's a beginning, a middle, and an end.
Yeah.
And once you go through the process,
From, through, to. From the wounds of childhood through the process of healing to a paradigm shift out of psychological prison, as I like to call it.
as one lady wrote here, I actually had one therapist who sort of dumped me. He said I didn't need him anymore, and I'd made enough progress to permanently leave therapy. So there you go. There is an exit. There should be an exit strategy. You got there for a reason, and maybe there needs to be a reason for you to move on.
Yeah, and if a therapist and a patient decide to end therapy, it shouldn't feel like a dump. It should feel like a completion. And
Right. It should be more of a hallelujah than anything else.
Exactly.
Because you've succeeded in terms of your goal of getting assistance to whatever challenge that was. So now we're going to go to our segment of our show called Shrink That Tune. And Dr. Judy seems to have found a real winner in this one. It's called Basket Case by Green Day.
Not Green Bay.
Green Day. So I'm going to
Day.
read the lyrics, and then Dr. Judy is going to interpret it from the mind map psychological perspective. Do you have the time to listen to me whine about nothing and everything? All at once, I am one of those. Melodramatic fools, neurotic to the bone, no doubt about it.
So it seems like this person is whining and wanting people to listen to their neurotic, melodramatic stories. So probably using their friends for this, and it would be better for them if they were just seeing a therapist and being a candidate for therapy.
Yep. I love this line. Sometimes I give myself the creeps. Sometimes my mind plays tricks on me. It keeps adding up. I think I'm cracking up. Am I just paranoid or am I just stoned?
So is this drug-induced psychosis here, or is this emotional bandwidth kind of coming to an end? So they're already questioning their mental health, but maybe this person's building up to be a candidate for psychotherapy.
Well, the next stanza. I went to a shrink
they did it.
to analyze my dreams. She says it's lack of sex. That brings me down. I went to a whore. He He said my life is a bore, so quit my whining because it's bringing her down.
Well, it's interesting that the shrink said it's lack of sex, so Freudian, Yeah, sex will cure it,
Absolutely.
Just spare your money and just, and then the comparison between going to a shrink and going to a whore, which is going to give you more relief, right? I love that. I love that
Relief.
whole paragraph.
Okay,
right.
Relief's important.
Yeah.
And then lastly, this, of course, sometimes I give myself the creeps. Sometimes my mind plays tricks on me. It all keeps adding up. I think I'm cracking up. Am I just paranoid?
Yeah, this person's starting to question their own mind, and so that's a good start. You start questioning, like, what's up with me? What's the matter? Am I paranoid? Am I cracking up? Is my mind playing tricks on me? So that's a good starting point to say, I wonder if I need some more help than a whore.
Maybe it's time to go to a therapist.
Right.
Grasping to control, so I'd better hold on. And then again, sometimes I give myself the creeps. Sometimes my mind plays tricks on me. It all keeps adding up. I think I'm cracking up. Am I just paranoid or am I just stoned?
And this grasping to control, so I better hold on. So they're trying to be their own therapist and control the whole thing, and they're just holding on, which is not really therapeutic because it's more of the suppression and the repression and all that. So I think that this person's a candidate.
Absolutely. And more of you out there are than not, so invest in yourself, and you can check us out at drjudywtf.com for, of course, What the Freud. If you have a question, you want notes from the show, or a show we think we might, we're getting some suggestions for shows lately, or a song you want us to shrink, please write us at info@drjudywtf.com. And, of course, you can catch us on iTunes, iHeartRadio, YouTube. Thanks for all the subscribers, and we're getting a bunch of comments. We love all those, and
thank you so much for liking us on Facebook.
And thanks for liking us on Facebook.
Nice,
and we have a great little community that's happening there too. So thanks for watching and listening. This has been your host, Walt Lusk, with Dr. Judy Rosenberg, and next week we'll try another fantastic show. So stay tuned, and until then, God bless everyone.